Now we'll quickly look at the next for the next discussions we should be looking at, and we're trying to look at two things that have to do with bone health. So we're looking at the peripheral bone density test and bone turnover markers. Okay, so we're looking at peripheral bone density test, then we're also looking at bone turnover markers. So for the two of them, we're just trying to look at what are their uses. Okay, so peripheral bone density test mainly is to measure what? The strength of bones at places like the wrist, the heel, the finger. While the bone turnover markers, those ones, you mainly see them in urine or blood. Do you understand? So those ones are trying to reflect the health of the bone. Do you understand? I'm coming. So it's just trying to show you how much bone is being formed, how much bone is being destroyed. Okay, so that's what we got. So peripheral bone density test, we said that those ones that are non-spinal, they are non-hip bone mineral density assessments. They are often used for screening, and trying to know how dense the bone is. So sites mainly measured include the heel, that's the calcaneus, you have the forearm, that's around the radius and the ulna, we have the finger, phalanges, we have the tibia. So techniques, we have the peripheral dense X-ray absorptiometry, we have quantitative ultrasound, we have peripheral quantitative CT scans. So advantage is very portable, do you understand? It's lower cost and you can screen a lot of people within the same time. So it's mainly used in the primary care and community settings to identify individuals that are at risk, of having all of that. Okay. So for the bone turnover markers, we said that they are biochemical indicators of bone remodeling activity. So they're usually measured in blood and urine. Okay. So most of them, you see, their names include serum bone specific alkaline phosphatase. We have the osteocalcin. We have the pro-collagen type 1 N-terminal propeptide. Then for the resorption markers, we have the urine or serum C telopeptide. We have the N-telopeptide. We have the deoxypyridinoline. Okay, so it's mainly to look at how healthy the bone is, to see if there's any possibilities of you having any fractures within a particular time frame. So that's what we have for these two.